Self-Mastery Through Conscious Autosuggestion. By Emile Coué. 1922. This audiobook is brought to you by the Project Wisdom. Observations on what autosuggestion can do. Young B, 13 years old, enters the hospital in January 1912. He has a very serious heart complaint characterized by a peculiarity in the respiration. He has such difficulty in breathing that he can only take very slow and short steps. The doctor who attends him, one of our best practitioners, predicts a rapid and fatal issue. The invalid leaves the hospital in February, no better. A friend of his family brings him to me, and when I see him I regard him as a hopeless case, but nevertheless I make him pass through the preliminary experiments which are marvelously successful. After having made him a suggestion and advised him to do the same thing for himself, I tell him to come back in 2 days. When he does so I notice to my astonishment a remarkable improvement in his respiration and his walking. I renew the suggestion, and 2 days afterwards, when he returns, the improvement has continued, and so it is at every visit. So rapid is the progress that he makes that, 3 weeks after the first visit, my little patient is able to go on foot with his mother to the plateau of Villers. He can breathe with ease and almost normally, he can walk without getting out of breath, and can mount the stairs, which was impossible for him before. As the improvement is steadily maintained, little B asks me if he can go and stay with his grandmother at Carignan. As he seems well I advise him to do so, and he goes off, but sends me news of himself from time to time. His health is becoming better and better, he has a good appetite, digests and assimilates his food well, and the feeling of oppression has entirely disappeared. Not only can he walk like everybody else, but he even runs and chases butterflies. He returns in October, and I can hardly recognize him, for the bent and puny little fellow who had left me in May has become a tall upright boy, whose face beams with health. He has grown 12 centimeters and gained 19 pounds in weight. Since then he has lived a perfectly normal life. He runs up and down stairs, rides a bicycle, and plays football with his comrades. Mademoiselle X, of Geneva, aged 13. Sore on the temple, considered by several doctors as being of tubercular origin, for a year and a half it has refused to yield to the different treatments ordered. She is taken to Monsieur Baudouin, a follower of Monsieur Coué at Geneva, who treats her by suggestion and tells her to return in a week. When she comes back, the sore has healed. Mademoiselle Z, also of Geneva, has had the right leg drawn up for 17 years, owing to an abscess above the knee which had to be operated upon. She asks Monsieur Baudouin to treat her by suggestion, and hardly has he begun when the leg can be bent and unbent in a normal manner. There was of course a psychological cause in this case. Madame Urbain Marie, aged 55, at Maxville. Varicose nicer, dating from more than a year and a half. First visit in September, 1915, and a second one a week later. In a fortnight the cure is complete. Emile Coué, 10 years old, Grand Dru, 19, a refugee from Metz. Some unknown heart complaint with vegetations. Every night loses blood by the mouth. Comes first in July, 1915, and after a few visits the loss of blood diminishes, and continues to do so until by the end of November it has ceased completely. The vegetations also seem to be no longer there, and by August, 1916, there had been no relapse. Monsieur Hazat, aged 48, living at Brünn. Invalided the 15th of January, 1915. With specific chronic bronchitis, which is getting worse every day. He comes in to me in October, 1915. The improvement is immediate, and has been maintained since. At the present moment, although he is not completely cured, he is very much better. Monsieur B has suffered for 24 years from frontal sinus, which had necessitated 11 operations. In spite of all that had been done the sinus persisted, accompanied by intolerable pains. The physical state of the patient was pitiable in the extreme. He had violent and almost continuous pain, extreme weakness, lack of appetite, could neither walk, read nor sleep, etc. His nerves were in nearly as bad a state as his body, and in spite of the treatment of such men as Bernheim of Nancy, Digerin of Paris, Du Bois of Bern, X. of Strasbourg, his ill health not only continued but even grew worse every day. The patient comes to me in September, 1915, on the advice of one of my other patients. From that moment he made rapid progress, and at the present time, 1921, he is perfectly well. It is a real resurrection. Monsieur Nagingist, aged 18, Rue Cellier, 39. Suffering from Pott's disease. Comes to me in the beginning of 1914, having been encased for 6 months in a plaster corset. Comes regularly twice a week to the séances, and makes for himself the usual suggestion morning and evening. Improvement soon shows itself, and in a short time the patient is able to do without his plaster casing. I saw him again in April, 1916. He was completely cured, and was carrying on his duties as postman, after having been assistant to an ambulance at Nancy, where he had stayed until it was done away with. Monsieur D., at Jarville. Paralysis of the left upper eyelid. Goes to the hospital where he receives injections, as a result of which the eyelid is raised. The left eye was, however, deflected outwards for more than 45 degrees, and an operation seemed to be necessary. It was at this moment that he came to me, and thanks to autosuggestion the eye went back little by little to its normal position. Madame L., of Nancy. Continuous pain in the right side of the face, which had gone on for 10 years. She has consulted many doctors whose prescriptions seemed of no use, and an operation is judged to be necessary. The patient comes to me on the 25th of July, 1916, and there is an immediate improvement. In about 10 days' time, the pain has entirely vanished, and up to the 20th of December, there had been no recurrence. T. Morris, aged 8½, at Nancy, Club Feet. A first operation cures, or nearly so, the left foot, while the right one still remains crippled. 2 subsequent operations do no good. The child is brought to me for the first time in February, 1915. He walks pretty well, thanks to 2 contrivances which hold his feet straight. The first visit is followed by an immediate improvement, and after the second, the child is able to walk in ordinary boots. The improvement becomes more and more marked. By the 17th of April the child is quite well. The right foot, however, is not now quite so strong as it was, owing to a sprain which he gave it in February, 1916. Mademoiselle X., at Plainville. A sore on the left foot, probably of specific origin. A slight sprain has brought about a swelling of the foot accompanied by acute pains. Different treatments have only had a negative effect, and in a little while a suppurating sore appears which seems to indicate caries of the bone. Walking becomes more and more painful and difficult in spite of the treatment. On the advice of a former patient who had been cured, she comes to me, and there is noticeable relief after the first visits. Little by little the swelling goes down, the pain becomes less intense, the suppuration lessens, and finally the sore heals over. The process has taken a few months. At present the foot is practically normal, but although the pain and swelling have entirely disappeared, the back flexion of the foot is not yet perfect, which makes the patient limp slightly. Madame R., of Chavigny. Metritis dating from 10 years back. Comes at the end of July, 1916. Improvement is immediate, the pain and loss of blood diminish rapidly, and by the following 29th of September both have disappeared. The monthly period, which lasted from 8 to 10 days, is now over in 4. Madame H., Rue Gilbert de Pivercourt, at Nancy, aged 49. Suffers from a varicose ulcer dating from September, 1914, which has treated according to her doctor's advice, but without success. The lower part of the leg is enormous, the ulcer, which is as large as a 2-franc piece and goes right down to the bone, is situated above the ankle. The inflammation is very intense, the suppuration copious, and the pains extremely violent. The patient comes for the first time in April, 1916, and the improvement which is visible after the first treatment, continues without interruption. By the 18th of February, 1917, the swelling has entirely subsided, and the pain and irritation have disappeared. The sore is still there, but it is no larger than a pea and it is only a few millimeters in depth. It still discharges very slightly. By 1920 the cure has long been complete. Mademoiselle D., at Mirecourt, 16 years of age, has suffered from attacks of nerves for 3 years. The attacks, at first infrequent, have gradually come at closer intervals. When she comes to see me on the 1st of April, 1917, she has had 3 attacks in the preceding fortnight. Up to the 18th of April she did not have any at all. I may add that this young lady, from the time she began the treatment, was no longer troubled by the bad headaches from which she had suffered almost constantly. Madame M., aged 43, Rudiments, 2, Malesville, comes at the end of 1916 for violent pains in the head from which she has suffered all her life. After a few visits they vanished completely. 2 months afterward she realized that she was also cured of a prolapse of the uterus which she had not mentioned to me, and of which she was not thinking when she made her autosuggestion. This result is due to the words, in every respect, contained in the formula used morning and evening. Madame D. Choisy-Leroy. Only one general suggestion from me in July, 1916, and autosuggestion on her part morning and evening. In October of the same year this lady tells me that she is cured of a prolapse of the uterus from which she had suffered for more than 20 years. Up to April, 1920, the cure is still holding good. Same remark as in the preceding case. Madame Jocelyn, aged 60, Rue des Dominicains, 6, comes on the 20th of July, 1917, for a violent pain in the right leg, accompanied by considerable swelling of the whole limb. She can only drag herself along with groans, but after the séance, to her great astonishment, she can walk normally without feeling the least pain. When she comes back 4 days afterwards, she has had no return of the pain and the swelling has subsided. This patient tells me that since she has attended the séances she has also been cured of wide discharges, and of enteritis from which she had long suffered. Same remark as above. In November the cure is still holding good. Mademoiselle G.L., aged 15, Rue du Montet, 88, has stammered from infancy. Comes on the 20th of July, 1917, and the stammering ceases instantly. A month after I saw her again and she had had no recurrence. Monsieur Ferry, Eugene, aged 60, Rue de la Côte, 56. For 5 years has suffered from rheumatic pains in the shoulders and in the left leg. Walks with difficulty leaning on a stick, and cannot lift the arms higher than the shoulders. Comes on the 17th of September, 1917. After the first séance, the pains vanish completely and the patient can not only take long strides but even run. Still more, he can whirl both arms like a windmill. In November the cure is still holding good. Madame Lecoeur, aged 63, Chemin des Sables. Pains in the face dating from more than 20 years back. All treatments have failed. An operation is advised, but the patient refuses to undergo it. She comes for the first time on July 25, 1916, and 4 days later the pain ceases. The cure has held good to this day. Madame Martin, Grand Rue, Villeville, 105. Inflammation of the uterus of 13 years standing, accompanied by pains and white and red discharges. The period, which is very painful, recurs every 22 or 23 days and lasts 10-12 days. Comes for the first time on the 15th of November, 1917, and returns regularly every week. There is visible improvement after the first visit, which continues rapidly until at the beginning of January, 1918, the inflammation has entirely disappeared. The period comes at more regular intervals and without the slightest pain. A pain in the knee which the patient had had for 13 years was also cured. Madame Costelli, aged 41, living at Tinville, M. has suffered from intermittent rheumatic pains in the right knee for 13 years. 5 years ago she had a more violent attack than usual, The leg swells as well as the knee, then the lower part of the limb atrophies, and the patient is reduced to walking very painfully with the aid of a stick or crutch. She comes for the first time on the 5th of November, 1917. She goes away without the help of either crutch or stick. Since then she no longer uses her crutch at all, but occasionally makes use of her stick. The pain in the knee comes back from time to time, but only very slightly. Madame Meter, aged 52, at Inville. For 6 months has suffered from pain in the right knee accompanied by swelling, which makes it impossible to bend the leg. Comes for the first time on December 7, 1917. Returns on January 4, 1918, saying that she has almost ceased to suffer and that she can walk normally. After that visit of the 4th, the pain ceases entirely, and the patient walks like other people. Emile Coué.